All right. Hello, everyone. So glad to see you folks here. My name's Zack Siddeek. I am the Disability Systems Navigation Coordinator over at the Arc of King County. I'm autistic. I'm a social worker and someone who just really, strongly believes in the importance of people with disabilities having a voice on, matters that have a direct impact on our lives. And for better or worse, medical care is something that pretty much all of us will need at some point in our lives. And I'm sure as many of you in this audience know, um, good accessible medical care can be very difficult to access for a variety of different reasons. And it has, a lot of different impacts on our lives. Some of those impacts can be, maybe minor annoyances to things as impactful as death. And, it definitely brings this sort of like cloud over our lives in a lot of different ways. And, that's a topic we wanted to explore a little more today. And I'm also very lucky, like, I'm not here alone talking about this. I've got, four very cool panelists here along with me. So I guess with all that being said, let's jump into the first question, which is, who are you and why did you think participating on this panel was a good life decision? Oh, and also include a visual description, which I forgot to do. So I am a 30-something-year-old white dude with a beard and short hair wearing a headset. So Kaley, since you were first to show up, I guess you get to go first.
Cool. Sounds good. Hi, everyone. My name is Kaley Duggar. I use she, her pronouns. I'm a white woman in my late 20s. I have brown eyes and long brown wavy hair. Behind me is a dark wooden hutch with like a mug and a candle on it. Um, as I said, my name's Kaley. I am I've lived with disabilities for most of my life. I had a disease at the age of 7 that resulted in bilateral below the knee amputations and kidney failure. So I use a wheelchair in my everyday life, and having, been disabled for most of my life, disability justice is something that's very, very important to me. And it's very central to everything that I do in my life. So I'm excited to be here today. I used to work at the Arc of King County for 2 years, so love the Arc and really loved working there, working at the Arc. This, I think, is really one of my core passions, which is, disability justice in healthcare. I am very interested in medicine. I'm actually starting medical school this summer. And I'm, am really passionate about all the ways that medicine currently fails people with disabilities and the inequities that are present for people with disabilities in healthcare. So my objective in becoming a doctor is trying to help change that system from the inside out. Because I know from my experiences and the experiences of all the people with disabilities I know and love and have supported, that it's not a great system as it currently is. So it's important to talk about.
Awesome. Thank you, Kaley. Next, let's do Carrie.
Hi, I'm Carrie, she, her, or they, them pronouns. I'm a white woman in my mid to late 40s wearing an African wax print shirt, and it looks like I'm about to do an expose in the background. I'm the Rooted in Rights office here at Disability Rights Washington, and I've been the director for about 5 months at Disability Rights Washington. Why was this a good life decision? Well, I have multiple disabilities. I was born with physical disabilities, but I also live with cancer and have anxiety and I've experienced trauma and have ADHD. So the honest answer is when Zack was asking for webinar topics and I was sitting on my sofa, I was like, please don't kill me at my next doctor's appointment. And so this is how I opted into this life decision, which was probably after a doctor's appointment in which I was telling a physician that I was taking a life-saving medication because I wanted to live, and he shouldn't have looked so confused about that. Wanted to give me an allergy medication instead of a chemotherapy. And I just always worry about the quality of my healthcare. And as an attorney, I know that I can advocate within the system, but I feel incredibly vulnerable because it requires that other people value my life too. And I can't provide my own healthcare. So I'm very excited for like a lot more disabled doctors. I'm very excited for Kaley to go to med school and get a prescription pad and kick some ass. That will be awesome.
Yeah, I think it's something we're all looking forward to as well. And we're also very glad you're here. So thank you. All right, next we have the, shall we say, infamous Jae Kim, also known as my supervisor. So take it away, Jay.
Hi, everyone. My name is Jay. I'm Information and Referral Program Manager here, the Arc of King County. I use she, her pronoun. I am wearing a shirt and have long black hair tied in back. Behind of me is a virtual background of a pink room. I wanted to do this workshop because as a person with a disability, I feel this topic doesn't get talked about. And our social service, healthcare forces us to live in poverty or meet specific criteria to receive benefits, which depressing. It pushes people off of cliff and prevents them from doing things like having a full-time job. Also, most of our medical services are for children with disabilities, and when they become adults, it is harder to receive medical treatments. There is an assumption that disabled people would become non-disabled when they turn adults, so there aren't many resources for them.
Yeah, thank you, Jay. And that's definitely, I'm sure, a recurring theme we'll be hearing. Like there are services for children and then services for adults, question mark at best. Jay also asked me to do her vision description. So she's a late 20s Asian woman with black hair, wearing a pink shirt and in front of a pink background with a lot of books and chairs that I'm pretty sure it's a virtual background. So thank you, Jay. And last but not least, we have Kay Barth. Take it away, Kay.
Hi, I'm Kay Barth. I'm autistic and disabled in many different ways. I've also experienced cancer. I'm also a caregiver to my mom who is disabled. And boy, do we have fun stories for this. Why did I think participating on this panel was a good life decision? Because as soon as I read the title, "Please Don't Kill Me at My Next Appointment," it just resonated. And I knew that this was a really important discussion to have, and I'm happy to be part of it. I do not have a visual description as my webcam is not on. However, I am a white woman in my mid-30s with long blonde and brown hair, and I'm sitting in my room office. Thrilling.
Very thrilling. Awesome.
Yep.
Thank you. We're glad you're here. All right. Well, thanks to you all so much for the introductions. Before we jump to the next question, I just want to say to the folks in the audience, we'll try to have a Q&A session at the end, but knowing some of the personalities on this panel, it may be up in the air on whether or not we'll have a Q&A just because we all love talking so much. So please, feel free to throw any questions that pop in your mind in the chat. I will be collecting those as we go through this presentation. And if there's a really good, pertinent, interesting question we get, I might deviate from the planned course and ask that question as we go through. So we just want to make sure that this panel can be, as pertinent to, your life and your reality as it can be. And if there's any accessibility stuff that, we can support you with, please send me a message or type it in chat and I'll definitely do what I can to take care of it. Awesome. So, this next question, it was kind of, y'all kind of hinted at it a little, but I'd like to explore it more. As people with disabilities, do you feel like the medical systems you've interacted with have been accessible? And what's the impact been on you? I could choose who goes first, or I can just awkwardly stare at the camera, which I think I'll do until someone speaks. Jay, I saw you nodding, so I'm assuming that means you want to go first.
I know a lot of people with disabilities who don't have access Medicaid, and most disability service are Medicaid funded, which means some cannot use them. For example, they are not eligible for Medicaid, so they cannot have long-term support. If the individual is an adult, this makes it even harder for them to be as independent as they would like. If you don't qualify for Developmental Disabilities Administration, that leaves you with almost nothing. Washington State has only DA as a main resource, which leaves out many people with disabilities who are immigrants or are less impacted by their disabilities. Our social services are based on defect model, and people need to be impacted greatly by their disabilities to get the services, otherwise they can't receive anything. Also, as I mentioned earlier, there aren't a lot of medical support for disabled adults, which impacts me. For example, my dentist has been telling me for years that I need a deep cleaning and recommending anesthesia for my whole body during the deep cleaning because I can't control my movement. I wouldn't want to take a risk for it.
Yeah, thanks, Jay. A lot of things in there that, have reflected my own experiences. Funny story, I was actually leading a support group last week, and, the topic that came up for like all of us was just like, hey, dentists are really, really inaccessible. And, you know, pretty much a lot of other like, forms of healthcare are inaccessible as well, and it can have very deadly impacts on our lives for sure. And your comments about like the impact of like not having long-term supportive services, and the impact of like once you turn 18, there's a service cliff, and if you don't appear to be so highly impacted, you don't get services like that. Those are recurring themes I've heard throughout my work as well. And I'm curious if other folks on this panel have had similar experiences.
This is Carrie. We could think about accessibility in a number of ways, and I think about physical access, and I think that for say like a pap smear or pelvic exam, there's so many stories. I thought I wanted to be a clinical psychologist, and then I had done this internship with the Rehab Institute in Chicago at the Women's Center when I was in college, and I realized that I wanted to work on systems because the stories that people are telling me about not being able to access healthcare or being told, oh, it's just your like emotions and mood, but it was really all these systemic barriers that were impacting people's connectedness and access and well-being. I just wanted to tear it all down. So I went off that track of like clinical psychology into law, which was its own hellscape, but there are just so many examples of like just OB/GYN visits. I mean, my naturopath has done a better job by being slower and a solo practitioner in making me comfortable and adjusting. But medical tables themselves, I know I fractured my back in Colorado and the x-ray table didn't really adjust. And I'm like, well, I can't really move. I mean, so I'm supposed to be in a position and I'm in incredible pain and we're trying to figure that out. And it's not accessible. A lot of the mammograms, now I'm in that part of my life, are not particularly accessible. And that's the physical access. And I'm someone who walks with a cane. So, but then I just think the attitudinal piece, which I know we'll get into more, But so much of the medical system, when I'm thinking about my anxiety, for example, like getting a mammogram and then being told to wait, and then we're going to do an ultrasound, and then you stay in this room, and then you wait some more. And so people are not really laying out the process, which means that we don't know what's happening to us. And I, experienced medical stripping as a child and those photos so that my family could get free healthcare through the Shriners Hospital. And I was always an advocate for myself as a child. So I'm used to navigating these systems and taking on adults. And now I have I have a child with disabilities, and really, like, she will notice the access, or even just the way people can't talk about disability. And then just like, how do you navigate this space when you're going to someone and you feel vulnerable and you need help? And I think the impact is that so many of us just avoid healthcare when I have the benefit of having, private insurance and a full-time job. And it's exhausting. Like, I don't want to deal with that. You kind of have to pace it out, because otherwise my life would be a series of like medical appointments and wanting to hide from the world to recover psychologically from the medical appointment, which would beget like a therapy appointment that would just do something else, right? So you're just in it and not sure who you're going to get, and very dependent on whether they see you as a full human being. And, some of my most physically accessible medical experiences, and I'm doing air quotes, have been like acupuncture or massage, where somebody understands, like, I need an adjustable table, or I want to make sure that you're comfortable before I ask you to take off your clothing, or hey, you've had hip replacements. If I'm asking you, if I take off your socks, you might need help putting them back on before you go outside. But just being seen, where other people are like in that healing mode, versus I tried to bill something to insurance and keep up with my schedule right now, and you already have a lot of issues, so what's this issue?
Totally. And what I keep going back to from what you were saying is just that piece about vulnerability. Like, these are moments when we're absolutely at our most vulnerable. There's a lot of fear that happens. We don't know what might happen when we schedule this appointment, if we're even able to schedule it in the first place. And yeah, it does seem to lead to, this fear then becomes like, will we get our needs met when we're vulnerable? If our needs aren't met, like, you talking about like therapy, yeah, it absolutely has had such a negative impact on me, like psychologically in those moments. And it seems like something other folks here have experienced as well. Kaley or Kay, which one of you wants to go next?
I can go. This is Kaley. Yeah, so a couple of things. Absolutely what Carrie was saying about like physical inaccessibility of the actual like exam tables and x-ray tables and all of that. That's so real. I don't think I have ever had a gynecological exam that actually worked for my body. And honestly, like, it begins even before you enter the exam room with the waiting room. As a wheelchair user, there is like almost never a actual place for me to be when I enter a waiting room. Like, it's all the chairs, arranged, and there's no space for me to be without, feeling like I'm in the middle of a walkway. And for me, that like always starts off my appointments with this anxiety, because I don't like to block spaces. I don't want to feel out of place the second I walk into my doctor's office, but I almost always do. And obviously the inaccessible exam tables has a bigger impact on my physical health, but you start off feeling like this isn't the place for you, and that means something. And then what Jay was talking about with the financial inaccessibility, I mean, the fact of the matter is that our healthcare system is so profit driven, and people with disabilities are at a higher risk of living in poverty and having poorer access to healthcare, having gaps in healthcare and access to insurance. And that makes healthcare inaccessible to a lot of people. A lot of people with disabilities, a lot of people who live in poverty, and it's a broken system. So that is just a reality that we all live with the way that our medical system works here in the US. Something that I've experienced a lot when I think about inaccessibility is really like bias and misunderstanding of disability from my healthcare providers. Having become disabled at such a young age, I learned how to understand disability and therefore how to understand myself and my place in the world, in part through my medical appointments, through my doctors and my physical therapists and occupational therapists. And, there was always just this culture that even though I was a kid, like I pieced it together, which is disability is bad and this is bad. And we need to get you to a place where you're fitting into able-bodiedness as best as you possibly can. For me, that meant, because I'm an amputee, that meant getting me up on prosthetic legs, walking around all the time, even when I was in pain and discomfort, not using my wheelchair. That was the pressure. And that's what I've really tried to do for so many years before I finally was just like, this isn't working for me. And I discovered that, like that, I realized that through other people with disabilities, and my relationships that I built with them, not through my interactions with the healthcare system. And that belief that disability is bad, that it's always a tragedy, that goes along with doctors thinking that people with disabilities somehow have less agency, aren't able to speak up for themselves or voice what they need and what their history is like. So there's a lot of mistrust because we often feel misheard by our providers. And obviously, the impacts of these things translates to poorer care. I experience this all the time where a doctor seems to, not think that I am capable of certain things because of my disability, making assumptions about my lifestyle or my past because of my disability.
If I can jump in and ask, like, what kind of assumptions?
I mean, this is one I always think of, which is I've been on a medication since childhood that is teratogenic, which means that it can cause harm if you are pregnant. It can cause harm to the fetus if you're pregnant. And even, once I started menstruating, nobody ever told me that, which, even though I was a child still, I was certainly should have been aware of the risks involved because it's perfectly possible that I was sexually active, but no one ever thought to share that information with me until I was like 22. And then I was like, oh, I didn't know that. I mean, it's not relevant. I'm not trying to get pregnant, but it's been a possibility. Like, why didn't I know this? Well, they probably just assumed that I didn't need to know that because there's such a common belief that people with disabilities don't have a sexuality or, that isn't something relevant to their care. Those kinds of assumptions lead to mistrust between me and my doctors. They lead to poor care. And for many people, they lead to really awful experiences and even fatal experiences.
Yeah, absolutely. There's so much really important things that you've said there. When talking about sort of like that anxiety, that you would feel like even in the waiting room when you didn't see any like spaces for people with wheelchairs, like that, that is always a horrible way to just like, you know, build trust with people with disabilities for sure, and absolutely something that does get overlooked constantly. I also wanted to say Jay wrote in chat that I love blocking people, lol. And yes, as someone who has seen Jay in public at least once, I can tell you that she absolutely does. And talking about like feeling like we belong, that is something that is often very rare for people with disabilities, visible or invisible. And it seems like that feeling is so pervasive in, healthcare, absolutely. And, it also goes to this idea of like, people, non-disabled people expect, other people to interact in a specific way with the world. And when that doesn't happen, maybe because of a disability, it just throws them for a loop. And I've just seen that so many times have really awful consequences. Carrie also wrote, doctors have suggested that I be sterilized, which I shouldn't be surprised. Yeah, but not the first time I've heard that. I'm so sorry that happened. All right. Last but not least, Kay, what are your thoughts on this?
Well, so the question is, people with disabilities, do you feel like the medical systems you've interacted with have been accessible? No, no, I do not. I actually recently read an interesting thought on Twitter about people saying, well, there's like a ramp. If it's not accessible for everyone, it's not accessible. You can't call it accessible if it's accessible for one person or one disability. It doesn't work that way. I have found it's not funny, but a amazing coincidence. We too have been having issues with dentists and accessibility regarding that and safety. We called to make an appointment for my mom, and she asked, or no, she said that she's in a wheelchair, and the woman immediately said, "We're not accessible," and hung up. She told her that they wouldn't be able to accommodate her and just hung up. That was the end of it. There was no discussion, no treating her like a human being, no talking about it, no trying to come up with a solution. It's horrible.
And like, if I
Another
can ask, like, what kind of appointment was that for?
she needs some teeth removed, and I think I don't know. I know that she actually just got back from an appointment that she was able to go to today, so I'm not entirely sure what they've decided. Thankfully, she was able to get in somewhere that has worked with people that are disabled. Um, but the fact that I mean, this person didn't even ask what kind of appointment my mom needed. She just said it wasn't possible and hung up. And I mean, I don't even know if that's, like, like, at the point, like, we were so over it that we did not pursue this or try to talk to anyone about it. The in oh, wait, no, that's question number 3. Uh, but the inaccessibility, it doesn't end there. It's everything from doctors not understanding different communication needs. Even if people, even if a clinic has a position in place on accommodations and is willing to do them, that doesn't mean that the doctor's aware or well educated or even knowledgeable in any way, shape, or form on what it is that you need to communicate at your appointment. And so no. Um, it's not accessible. And, oh, actually, you do ask, "What has the impact been on you?" We're tired. I'm tired. That is the impact it has had on me. I've been burned out for 3.5 years. We're tired. It's not fun trying to access the medical system as somebody without disabilities, and here we are as people with disabilities, and we're left on the wayside. We're left to claw our way out, and that's not right.
No, it's not. And yeah, like there have been so many opportunities, so many circumstances where, I've had similar experiences as well. Like when I've requested accommodations at my medical appointments, like especially dentists, like they might balk at me, even if I, requested it like a month or two ahead of time. And it's just like, it's like a lot of providers I've encountered do not really seem to understand the idea that like people with invisible disabilities exist, like people with sensory disabilities exist. And yeah, like you said, Kay, like I'm also like so tired from all of this advocacy. And I saw everyone like nodding, when you brought up being tired. And I think that really goes to the next question, which is what have you had to do to advocate for yourself and others, like your families or clients, what has the impact of the advocacy been on you? Jay unmuted herself, so I'm assuming that means she wants to go first. So take it away, Jay.
Sometimes I need to keep going even if a professional tries to send me away because that is the best option I got. Of course, I want to respect them, and I do, but sometimes it's the best option because there aren't a lot of other choices, and I should be healthy as I can. Also, I realize that I have to be detailed on why I need the service. For example, I just can't say to my insurance company that I would like to get a new communication device. I would need to explain it is 10-year-old and has to be upgraded, but it can't because the device is too old. They would say you already have a device, so they can't accept my request if I'm not detailed.
Right. And so it just like leads to these circumstances where you're like always having to justify your existence. And that can be so draining for sure. And of course, it's like, I when you were talking about like getting your AAC device replaced, I was, thinking about let's say a like non-disabled person wanted to get a new car, and like the salesman was like, "Wait, why do you need a new car? You already have one. Like, we can't sell you a car because of that." It's just like it's ridiculous. Like, A, we most of us need cars to get around, and B, like cars go bad after like 10, 15, 20, 30, 40 years. Like, of course we need to replace devices. Like I'm just shocked that yeah. I shouldn't be shocked, but yeah. Kay, what are you thinking?
Well, like I said, to advocate for myself and others, I guess I personally feel that I have not been doing that as much these last few years. It's been more difficult um, as I age, and I did hear that that happens with autism as you age. Things do become uh, well, my task initiation is very difficult. So other ways that I've had to advocate for myself are pushing for things when I'm in appointments instead of waiting to schedule another appointment and waiting months and months. But that is near impossible with my communication challenges. So unfortunately, a lot of my appointments are like a laundry list because I can't. Uh, I don't know how to explain what I'm trying to say. I apologize. Um, it it leaves you with a larger to-do list having to advocate. I mean, that's pretty obvious, but it just kind of piles up, so you're always dealing with these piles and mountains of things that you have to do, and again, that impact is it's just very exhausting, to have to do that all the time, to be carrying that all the time and chipping away at things. Um, I don't know if that answered the question.
It did for me. I think part of it sounds like, you're talking about autistic burnout there. Part of it is like, something I've experienced as well, where it's like, I definitely need these supports for my executive functioning to be able to do the things I need the supports for. And if I'm not getting the supports, then like the things aren't going to get done. No matter
Correct.
how important they are. And it's,
Yeah.
yeah, leads to this cycle. Um, and just like the sheer sort of like emotional energy you have to spend advocating,
Mhm.
A is exhausting, and B just adds another sort of like barrier on top of the, maybe the physical barriers, we're facing. So
Well,
yeah.
yeah. To actually bring it up, I do know, not a lot of people talk about it, but depression can be very debilitating.
Mhm.
And struggling with depression made it even more difficult for me to feel like I can and should advocate for myself, um, because there was really nobody trying for a long time. And I essentially got lost through the cracks in the medical system these last 2, 3 years, like with my autoimmune stuff. And everything else. And it's only now, after, like I said, years that I'm working on it, that I realize, you know, what was there for me to do. There definitely aren't systems in place to help people, really. I don't know how it happens.
Yeah, I've got a lot of theories as to why it happens. I'm sure other folks here do as well. Carrie, Kaley, one of you want to go next? Okay, Carrie, you do.
Sure. I was just thinking about this. So I feel kind of as expert as possible in many ways of navigating healthcare because I've been doing it for myself for so long. My parents agreed without even knowing what my diagnosis was to 38 surgeries for me between the ages of birth and 5. And so I will be damned if somebody does something to me without answering my why, which is a very threatening question for doctors. And I always ask it for myself, and I always ask it for my daughter. And people are not used to it. I'm like, what is the long-term outcome? Are you trying to straighten this leg to make it more aesthetically pleasing right now? Or someone has brought up, oh, if we lengthen your daughter's legs, she might be able to wear heels to prom. I said, and then she'll need a hip replacement because of the trauma that you have done. But yay, prom, we don't even know if she's going to go, and were heels part of it? Like, what is it? What are the long-term impacts? And often doctors don't think about that. But I was also thinking that it can be very isolating. So I have friends that have been going through health conditions, and they have people drive them to their appointments. Like, I took a friend to an appointment. I'm not complaining about doing that, but I was just thinking that I would never ask someone because I go so often. I've interacted so many times, but I like had a playlist for her, and we hung out during the infusion and we did all these things. And I'm like, they brought her snacks. She asked who the heck they were when a new nurse came in to change the bag. I was like, that's the person with the needle. So my idea of sort of the power in that situation is different. But I saw someone who has a pretty disabling condition, but what you would not identify as having a disability. I saw their healthcare experience for a few hours, and it's really been sitting with me for the past month or two how different it is. Like, I don't know the last time I was really offered snacks somewhere. I mean, I got a snack, I was the ride along, but it's like the disabled doula going to the appointment with the person who I could welcome to the disability community. And certainly their lives have been impacted, but they're so used to navigating healthcare in a way where they say they're having pain or anxiety, and someone says, oh, okay, like, let's do something about that. And they know the lingo that this is new for them. And I just thought it's really nice to have some supports, but we rally around people who have shorter term things going on. And those of us who are like chronically interacting, it's probably, like Kay was saying, most tired. So I think being most tired is not a place where many of us would reach out and say, yeah, I would like somebody to just sit with me while I wait for the results of this test, or bring a snack, or have a Spotify playlist. We just try to get through it on our own. So those supports kind of fall away for people. And I think it relates to what Jay was saying, that there's a lot of focus sometimes on kids with disabilities. Well, then what happens when they do grow up? So we don't even have like those supports built into our medical system, where it's like, somebody should distract an adult who's having a disability. Seattle Children's has a couple play therapists, for example, but adults struggle too. And people who are chronically ill and are frequent flyers in the medical system, we may know how things go, and I derive a certain comfort in being at somebody else's doctor's appointment because it's not happening to me. And I understand kind of the power dynamics of it, but no, I just kind of do it by myself. So I feel for you, Kay, in that way, because it just piles on.
Yeah, it does pile on. And, makes me think of the idea that like, when you were talking about like people will absolutely like rally around you when it's a short-term thing if you haven't had too many, like, medical experiences before. I was just thinking like, a lot of people see those of us with like chronic conditions as like disposable, whether or not there are medical professionals, and it does lead to this like loneliness and isolation, for sure. Kaley, I know you probably have a lot of thoughts on this. Yeah.
Oh, so many. I wanted to comment on something Jay had said about, needed requesting a new AAC device and that being denied. Often like denied by insurance, which is also so relevant for like needing a new wheelchair, but you haven't, it's per your insurance, it hasn't been long enough since you got that wheelchair for you to get another and for it to be paid for. And there's all sorts of these kinds of constraints put on us by our insurance because they want to spend as little as possible. That is clear that there's so much focus on the bottom line for them that we don't get the things that we need, no matter how, even if you have a doctor who like is supportive and will write all of the explanation of why you need this new wheelchair and why it's important for your health, your insurance company can still turn around and deny that. And there's nothing you can do. So that's just something I've been thinking about. But in terms of how I have to advocate for myself, I'm still learning how to do that. I'm 27 years old. For the longest time, my parents always were at my medical appointments. And I'm still learning how to fill their absence by asking all of the important nitpicky questions and explaining all of the important parts of my history that maybe aren't being considered. And, I've learned I had an experience, a terrible experience a couple years ago where I needed to have a procedure done on on scar tissue. Like it was pre-existing scar tissue from the disease I had when I was a kid, and I needed this procedure done on it. And the doctor was like, when she met me, she was like, oh, I read your chart, I read your history, like, oh my gosh, you've been through so much, like you're my hero, like you have been through so much and we're going to take good care of you. And she was the surgeon involved, and because she actually knew nothing about wound care for scar tissue, I ended up with a terrible infection and a open wound for 3 months. And it was awful. And I realized that like I felt this sort of, even though I don't like the whole "you're my hero" thing, I appreciated that it seemed like she was someone who at least understood my history. And in my head, that should mean you trust my expertise. You don't want to put me through unnecessary BS because you know just how much unnecessary BS I've been through already. You know when to realize that something is out of your scope and not have the hubris to, keep caring for me, even when I'm better off with someone who does know wound care for scar tissue. I just realized that like at a certain point I was like, no, you need to refer me to a wound clinic. Like you don't know what you're doing. And I had to be the one to call that out. No one, that wasn't even something that was being discussed. It was like, oh, we'll refer you to someone else. They were like, oh, we'll handle it. They literally gave me advice that made my wound worse. So I really had to put my foot down. And in the end, I actually kind of blamed myself for not having put my foot down, for not having put my foot down sooner, because it was so clear, looking back in hindsight that they weren't really taking my history into account, and they weren't acting with my best interest in mind. So, now I advocate by trying as hard as I can to ask all of the questions and say all of the things, and really push my doctors when it doesn't seem like they're getting it. But of course, like everyone has said, it is exhausting and it's very anxiety inducing and it's very uncomfortable to feel like the quality of your healthcare ultimately rests on you to say the right things. Right? When you're supposed to be able to trust your doctor, you're supposed to be able to trust that you're in good hands. And that's just so often not the case because you feel like if you don't say something, you're not going to get the care that you need. And even if you do say something, you might not get the care that you need. Um, I I don't have people come to my doctor's appointments either, but I should. That would be great because another pair of ears and eyes is helpful. I've gone to medical appointments with my clients with developmental and intellectual and physical disabilities, and it's great just to be there to like clarify understanding and clarify instructions from the doctor. And it's nice to just have another person there to make sure that everything is being said as clearly as possible. Uh, Not everyone has that. Not everyone, like Carrie was saying, especially when you're chronically ill, chronically disabled, you probably can't get your best friend to come to every appointment because that would take up all their time, the way it takes up all of your time that's not spent working and doing all the other things that you're busy doing. So when I sit down at waiting for the doctor to come into the appointment, I am just running through my head all of the like I always go in with a list of questions and ideas and things I will and won't accept. And I am kind of nervously just running over it in my head over and over and over again because I've been steamrolled in these appointments so many times. You sit down, you tell someone, here's what I'm going through, and they kind of just go with, oh, okay, well, here's how we treat that. Here you go. Bye-bye. And they don't even ask if have you had these symptoms before? Like what worked or didn't work in the past? All of that stuff often just gets glossed over, and then you're left with a treatment plan that wasn't for you. It was just for the idea of a patient, and your history isn't taken into account. Um, it's terrible.
Yeah, it absolutely is. And, Kay wrote in chat, it's actually really sad that we can say we blame ourselves for believing someone can and will do their jobs. Like, folks go to med school for like what, 7 years, 8 years to like learn how to do all of this, and they're still not able to take care of us. And we're still, in many cases, like having to do their jobs for them. Yeah, that's yeah, so a lot of thoughts there, a lot of feelings. Also, Kay let me know her computer crashed, so there are now 2 Ks in the um room here. Let me add the other one. Cool. Um, awesome. So, definitely appreciate everything y'all have said so far. It's also, very distressing to hear that like all of this is happening to y'all. So, again, thank you all so much for being willing to share your experiences. And now I'd also like to ask y'all about like sort of some of the systemic factors that are impacting all of this. Like, how do you see systemic factors playing into this? And then do you think like other forms of oppression are also impacting this, like whether it be racism, ableism, sexism, any of the other isms? Who wants to take this one first? Okay, Jay, go for it.
While we talk about racism, gender, otherism, we leave out disabilities in the conversation. They're nonverbal. People don't take extra time to understand them.
Jay, do you have more to say on that? Okay. Yeah. I definitely agree there for sure. It's like, yeah, it's just like our existences are so difficult for many of the providers to understand that they just don't take the time to consider or actually listen or look past their experiences. So yeah, I agree with you there. What do the rest of y'all think?
I can go next. I think, I talked about sort of this this is Kaley, by the way, this chronic feeling of, not being heard and my history not being taken into account and my concerns not being taken seriously by providers. I'm a white woman. I'm educated. I know those are things that give me an advantage. Even though I have so many complaints, those are things that are giving me an advantage. And there are, people of color who are also disabled or also sitting at various other intersections of marginalized identities who are experiencing that times 10, times a million, because not only are they disabled and a woman and queer, they're Black and English isn't their first language, and there are all these other biases that overlap and equate to these experiences in healthcare. And sorry, I have more. And I think that, given that I'm going to be a doctor and I'm going to be in medical school soon, my biggest like systemic focus is on the poor education that doctors receive about disability. I think that is like in medical school. I mean, firstly, you have to realize that there's so much for a doctor to learn, that there is those 4 years in medical school are jam-packed, and yet they still miss so many important things. Disability is not like people do not receive a comprehensive disability education in medical school. It is not a core part of curriculums. It is just not something like that is discussed besides the obvious, like, oh, your patient could be disabled by this disease, and here's but so much of the focus is on like preventing disability and avoiding it altogether. And doctors don't learn what it's actually like to live with a disability. They don't learn about the different types of disabilities. They don't hear from people with disabilities. I mean, that's the crux of it, is they're not getting any kind of opportunity to really talk with and be educated by people with disabilities, with diverse disabilities, who could, really teach them what it's like to live with these conditions. And so that's something that all of the biases, the ableist beliefs, the doctors treating their patients like their disabled patients like their word can't be trusted, or like they're not able to speak for themselves or make decisions for themselves. These are things that permeate our society, and so they permeate our medical system too. And without specific system-wide education and re-education, that's not going to change. And that's something I care a lot about and want to actively change. And I mean, I will say that like some medical schools have started to include disability in their curriculum. Like it's not something that isn't being talked about at all, but that's kind of, that movement is kind of just beginning, and it's gathering steam and building up. But it's going to take a lot of advocacy to get there.
Well, I definitely hope I live until the time when it happens. I think that'll be so critical for sure. Carrie, what about you?
This is Carrie. I just think about everyone we don't see on a regular basis and their vulnerabilities. So some of the work at Disability Rights Washington, we recently had a settlement with the Department of Corrections for gender affirming care for trans inmates with disabilities. I think about the level of care or lack of care in institutions where we have members of our communities, and then, forced medication or chemical restraints. I also just think about, we were just talking today at the office about solitary confinement and the impacts of that, and what is a health-based solution when our prison system thinks it cost over $200 million or something to stop using solitary confinement. So we have all these isms in institutions that not only create disability, but exacerbate them. And then I think, in addition to like the linguism and racism and sexism, I think about the hierarchy of disability and how stigmatized some disabilities are. And I definitely make choices to not share everything with all of my providers sometimes because I want them to give me the best treatment possible. And then also just not I was seeing Jae Kim's comment that racism adds more factors like Black AAC users, who is a woman, for example. So even in occupying a space of privilege, I just think like maybe I don't want my doctors to know about everything because then they won't believe me as much. I see Lee, who's one of my colleagues, made a comment that you can't go in with a physical or written list because that's medical or diagnosis seeking. Exactly. There's so many perceptions that like people with disabilities don't have health. So what are you exactly complaining about? You don't have health or wellness. One thing I remember from that time at the Rehab Institute when I was 19 was that the doctors and residents did grand rounds and they were talking about at what point would they not want to live anymore with different kinds of disabilities, right? I mean, hopefully this is handled in a better way when Kaley goes to med school. But, there were many doctors in that conversation, and I was an intern who said they wouldn't want to live if they couldn't go skiing anymore. And I'm like, geez, I mean, there is adaptive skiing. We can teach them about that. But if that's how you feel about disability, the level of anxiety and fear about having a physical disability, which, can be among the least stigmatized of disabilities in many ways, that you don't want to live if you can't go skiing, I really can't trust you to give me the best care possible. And that is frightening. So I'm kind of glad they talked about it, but I just remember going like, wow, you have no idea what it would be to live in this way. And so what would you recommend to people? What treatment would you offer? Withhold? Lee had another comment in the chat, Zack, too, about birth control. People, being added to medical lists somewhere along the way, more commonly. Yeah, we know the forced sterilization of communities of color and tribes. It's all very interconnected.
Yeah, it absolutely is. Like all these forms of oppression, intersect with one another for sure and create deadlier consequences. And something I feel like we could do a whole nother, webinar on. We may very well end up doing that because it is a very important topic. And just so much to reflect on there. I think it seems like the core of this is like the idea of like a good quality of life means like the way non-disabled people would live life, the way like non-disabled people would ski. And it's just like, like what you were saying, Carrie, like doctors, most of them can't just imagine that it's possible to have a good, happy life, as a person with a disability, really any kind of disability. Yeah. And so thinking about like what Kaley was saying about the lack of education, yeah, absolutely agree. That needs to be addressed for sure. And then I believe Kay, you'll probably have stuff to say here, right?
Well, regarding other systemic factors that are creating these experiences, really, as a white woman, I've, just faced sexism, not just faced. But I can't speak to anything else personally. However, I do know that it's still, even now, years and years later, a huge problem that the gender bias in the medical community leaves more women misdiagnosed with mental illness when it's autism. Or let's say it's a co occurring thing. So they think they're just treating your depression or your anxiety and not notice that you're autistic because you're a woman, or your concerns are dismissed as just anxiety more often. It's already difficult getting people to listen to me when I do struggle to communicate. So when you throw on that extra level of, uh, you know, what I'm saying not mattering because I'm not a dude, it becomes even more difficult. So I think that plays a pretty big impact. Obviously, racism, and somebody mentioned linguism, and that's huge. Like there are some people that do not want to be nice to people that don't speak a different language. They don't want to provide care to somebody that doesn't speak another language, and that is absolutely astounding to me. So there are definitely a lot of different factors and a lot, even more intersections between them that lead to people not getting the level of care that they need and deserve. They have the basic human right to have. Um, yeah, I feel like I kind of wrapped that up. I don't really have anything to expand on.
Sure. Thank you. I think, reflecting on the idea of like language access, it is absolutely critical and a very, an issue that absolutely plays a big part in this. And also in terms of like thinking about like language access in the disability world, like probably the folks who, like are the most marginalized here are going to be, I think, the AAC users, like especially the BIPOC AAC users as well. Um, Very, very few, like medical providers I've run across have even, thought about like how would someone who, doesn't like speak to communicate actually communicate, and like how would you be able to provide accommodations in appointments in those settings? Especially for mental health care as well, big barriers there. So yeah, definitely appreciate what y'all have had to say there. Jay also wrote in chat a few minutes ago to make others feel comfortable. I think that, you know, pretty much like if there's one thing I've learned in this work, it's that the pace of change only happens at the level of non-disabled comfort. If they're feeling defensive, things aren't going to change. And definitely been the hardest thing for me in this work. And so, jumping on to question 5, I'd love to hear from y'all. Like, what do you think needs to change to create a more supportive and healing healthcare system for people with disabilities? And I specifically ask this question now because I see Jay is typing and I want to give someone else a chance to jump in first.
I'm happy to jump in. I mean, I think I already, really hit this hard, but one of my big passions is this failure to educate medical providers about disability in any kind of comprehensive anti-ableist way. I think that like because I already touched on that, I'll touch on another piece that feels just as important to me, which is that I think generally doctors or providers want to do better. That's my optimistic read is, when I talk with with other pre-medical students or medical students or doctors about these things, everybody's excited. Everybody likes to like they know how broken the system is. Like maybe not everyone, absolutely. It's not something that everyone has an education about, but like that is very much like improving the healthcare system is very much something that like I believe most doctors want to do. But of course, the education piece is there. And then there's also, you know, these other systemic factors like the way our healthcare system works and how profit driven it is and how efficiency focused it is. There's not time to do to understand a patient with disabilities to the depth that they need to be understood for their care to be provided, you know, for their care to be high quality. Like the time of that you get with a doctor is so often like a 15-minute appointment because doctors and providers are expected to, you know, go through as many patients as possible in a single day. Like that is a huge factor. I mean, how limited your care is if you don't have private insurance or you don't have high quality private insurance, that puts so many limitations on what you can accomplish with your medical provider in the time that you have with them. So it's not just about this education, but it's also this simultaneous like policy change in how we administer healthcare in this country. I believe that very strongly, which is not to be said that improvements can't be, you know, improvements can be made in like just establishing every medical student's curriculum includes disability, you know, in a meaningful way. That's great. That's huge. But then they also, once they actually become practicing physicians, they need the time and the support and the resources to, you know, spend an hour with a patient if that's what it takes to actually understand their history and communicate with them and, you know, and actually provide them with the quality care they need. They need doctors' offices and hospital systems to provide interpreters and you know, different communication aids. Like all of these things have to be built in, and I see you know, the profit-driven nature of our system as such a barrier to that, unfortunately.
Starting to sound a bit like a social worker there, and I appreciate it for sure. So, you know, you mentioned like systemic factors within the education system, systemic factors, and like how all of this gets paid for by the insurance system. Do you think like representation impacts this as well? Like I've read something like, what is it, 2% of doctors report having a disability out of like, you know, compared to the general population, it's like what, 20-25%?
Oh yeah, absolutely. It is like less than 1%. I think the last time I looked at the percentage of doctors who are disabled. Of course, that's not that is an undercount, I'm sure, because a lot of doctors probably don't disclose their disabilities or, you know, don't see themselves as disabled when in fact they potentially could fit into that category, you know. But yeah, it's hugely underrepresented, and that doesn't match the needs of the population. It doesn't represent us, and that is a problem because you're more likely to advocate for this type of education if it's in line with your personal experiences. Like I am disabled, and that's why I am that the experiences I've had being disabled and being a patient are interconnected, you know, with why I care about this so much. So the more doctors you get who are live with a disability or understand disability more deeply, just as a life experience, the better the more optimistic I am that change occurs. But then that also goes along with, you know, administrators and leaders and people in power who will listen to disabled doctors and disabled medical students.
I'm sure that will absolutely happen after a lot of blood, sweat, and tears on our part, for sure.
Yeah, I'm optimistic about it. I think I think it's something that's inevitable. I mean, I think medicine in general is moving toward a more well, medicine in some places. We do live in the United States and things are very uneven based on where you live. But I think that in a lot of healthcare systems there and healthcare education, there is a bigger focus on how racism and sexism and homophobia and all these other isms, how that impacts your care, and the importance of representation, because the more Black doctors we have, you know, the more people we have that are more likely to be passionate about, you know, the horrible infant mortality rate for Black women and Black babies. Like, we understand the importance of doctors who have experienced what their patients experience.
Totally. Thank you. Jay wrote in chat, Kaley stole my thoughts. Jay, does that mean you have nothing else to say? Oh, okay, I guess not. Unfortunate.
We need specialists who have disabilities because almost all specialists aren't disabled. We need specialists who have disabilities and use social model which truly respects the disabled individual as a human being. It is an empowerment model that focuses on support and accommodations. Also, more professionals who understand cultural differences.
Yep, definitely agree there. Thanks, Jay. Kay, you just unmuted yourself. Go next.
Yeah, no, I'm glad Jay said what she did, because it reminded me in something you said earlier about people with like chronic illnesses being disposable, or people with disabilities being disposable. I think doctors need to, and anyone in the medical field, really have a better understanding that there is no cure to aim for. Treat us as we are. Meet us where we're at. And like Carrie even said, like there was that the instance where you were having surgeries that were based on an ableist notion that a leg needed to look a certain way. That surgery is actually, in fact, unnecessary without that ableist view, like being imposed on you. And so, kind of just looking to improve our quality of life where we are with what we experience, because you're not going to treat it out of us. That our disabilities, our disability in itself is lifelong. And I have to wonder if maybe some professionals find it frustrating to deal with medical problems that they cannot change or fix, but that means that they need to understand that there are things that cannot be quote unquote fixed, nor do they need to be. You can improve our lives as we are without trying to shove us into a treatment plan that is not built for people like us.
Yeah, I think that really hit the nail on the head there. Just the idea that, like, you know, doctors are used to treating like sicknesses, diseases that, you know, can be cured with the right medication and treatment plan. And when it's a lifelong, you know, chronic disability like autism or like cerebral palsy or, you know, being an amputee, like there's not really much that can be quote unquote cured. That hasn't stopped them from trying, though, to our detriment, unfortunately. Carrie, I'd love to hear your thoughts before we jump to audience questions.
Yeah, this is Carrie. I was just thinking what a position of power as messengers that doctors and others in healthcare occupy. So doctors, just thinking about, I used to lead the Office of the Education Ombuds. And so much what the families that contacted us when their children were diagnosed with a disability of some kind, they learned what that disability was from the doctors. But those doctors didn't necessarily, one, have a disability or identify in that way, and weren't necessarily connected with disability communities. So there was, I'm just tying together what everybody else says, that there's really wasn't like, hey, welcome, you can have disability pride and disability identity can be positive. And here's some other people that live with that disability and are in adulthood. And so it is this focus on grief and loss and normalization. And that is very hard to, even harder to understand when that's in translation or interpretation and cultural values and just across all of those things. Yet people kind of do it cavalierly, and a family or a person just gets some news and they're kind of alone with it. So I think, yeah, we need to take over healthcare and genuine, authentic connection with community to be like, your health is more than me doing this prescription or this brace or this referral, but here's some other places where you can feel connected. You don't have to do it. I'm not sending you to all the cure groups or anything, but here's just like, there's more to you than this. And humbly, I don't know about the rest of this. And I don't think there is that humble aspect from doctors, many doctors, in that way.
Yeah, it's true. I've definitely noticed that. Like the better ones are the ones who know they still have a lot to learn and are humble and aren't set in their ways. So I'm so glad you named that and pointed it out. Okay, so we've got about 12 minutes left, and I know y'all know we do have a question 6, but instead, are y'all okay if we just skip that and go straight to audience questions? Okay, cool. Well, I would love to hear folks in the audience, if you have any questions, please either raise your hand using the reaction button or type it in chat, and we'd love to answer some of the questions y'all have. Did we just shock them into silence? Oh, Christy, were you raising your hand there? Okay, yeah, go ahead. Oh, let me unmute you. Okay, there you go.
Hi. So my biggest challenge, and I don't know how you guys deal with this, is my internal ableism, where there's times where you want to ask for an accommodation, but you don't want to be a pain in the ass. So so I'm sitting there thinking, okay, what would be the least I could ask for on this? Or what do you, because I don't know. That's my biggest challenge. So I don't know how I'm sure all of you have had that, but how do you deal with that with yourself when you're trying to say, go like for the dentist, where I'm like, I need a play by play. I'm like, pretend like you're a narrator of a story. I need a play by play. Don't just suddenly squirt water in my mouth. I want to, okay, now I'm going to do this. And so, sometimes I could tell they're thinking I'm a little too much, but I'm explaining to them that that's so I don't go into a panic attack.
Yeah, that's a great question. What do y'all think on that?
Are you asking for like scripting that you could use when asking for help, or are you asking more about identifying in the moment when you need help and what you can ask for?
I'm just referring to general things that you each would use for yourself when you have those moments. How do you talk yourself into, when you're recognizing, okay, I need this. This is important to me, and it is a big deal. It might seem stupid to someone else, but this will make a difference between whether I go home and I sleep for the rest of the day. So just things like that.
So basically like pushing through the idea, removing the idea that like we're burdens and we don't deserve, this care. Yeah, that makes sense.
And I think that's especially a problem if you're ability to do that sort of thing has changed over time, because you might think, well, I used to do this, why can't I now? And so you don't think that you need to access whatever accommodation is there. I wish I had a better answer for you then. I find myself in the same predicament often, which is I need an accommodation and I'm either unsure of how to approach it, or I've shut down in terms of communication to the point that I can't. I think that for me, because not to be the stereotype all or nothing, I think I'm just going to jump into every accommodation that I possibly have access to and see what helps me, because you know what? They're there. I'm going to ask for them preemptively, and I'm going to expect them to be there. And if they're not, I'm going to tell them that's a problem. I'm gonna do it because I don't know if there is a way to ease into accommodations. I've tried. I've had accommodations in school. I've had accommodations in jobs, but they haven't been the right ones or haven't worked out in the long term. They were something to get me through a stressor, not the entire duration of my time there. Do you know what I mean? Um, so all I can recommend, and again, this is somebody struggling with the same thing, is to jump in and just ask, because if you don't ask, if somebody doesn't know what's wrong, they can't help you fix it. And maybe people have been horrible about it in the past, but not everyone will be. And maybe if it'll help, pretend that you're asking for a friend or for a
You know,
child.
now you totally hit me with that, with no one's going to know unless you say something. I'm a mother of 3 autistic girls.
Yeah, so you
This
know.
all the time. And see, but I'm
Mhm.
autistic too. And I
Mhm.
have no problem telling them, I always say, I can't know how to accommodate you if you can't tell me what I need to do. But yet that just hit me so hard right now, because that's essentially what
Yep.
I'm doing, the same thing. And I can relate to you when you're saying as you get older, and I've had other autistic friends mention that as you get to be premenopausal, it's your executive functioning just really goes to the ringer too.
Mhm.
That's what I'm dealing with right now. It's the lack of spoons and just trying to,
Yep.
you know,
Yep, it's hard, and I empathize for sure. It's really hard to we've grown up in a society that made us think, A, that we're unworthy, and B, that we don't actually need that. If we were trying hard enough, we wouldn't need any of these things. So
Yep.
that's a lot to kind of deprogram ourselves from. Uh, yeah.
Awesome. Thank you for that answer, Kay. Jay wrote in chat, I think it's not my problem as long as I'm respectful. Yeah, that makes sense. Carrie or Kaylee, do you want to add anything to this?
This is Carrie. So I struggle with that. And it's been easier for me to walk out if it's an appointment for my daughter who has a disability and I feel like we've been wrong than for myself. However, and this is like maybe my own way of like self-accommodating, which we know we do too. And I do have insurance through my employer. So there are a lot of ifs here. This is one way in which I'm using this privilege. I try to maintain for my own well-being. I know people say stay in the same healthcare system for things. And like as somebody who has rare disorders, I think that would probably be like UW for me. And there's nothing against UW, but I could not do that for everything. So I like need a mix of small providers and the people that I have to just see. I think like Jay was saying, sometimes they're just people like you have to see. And I have done my research and I'm like, damn it, I'm stuck with this person. But if I had to do like, I just decided, I get migraines a lot and I had a neurologist here. I moved away, I came back, whatever. And he was going to make me wait like a new patient. But I'm like, I've been through all the treatments for migraines. I know the thing that I need for the migraines. So I'm just going to find like a nurse practitioner to go to. So I just try to simplify some elements of my healthcare so that I can deal with other people that I name out of humor, like Dr. Death, and just, do that. Because otherwise, I think I probably wouldn't leave my home. But you can do that, and there's like issues with the coordination of care. But for me, I'm like, I need like a little homey experience when I have a cold and I can go to a naturopath. And then, yeah, I need somebody who's a hematologist or an oncologist, but there's gotta like be a mix of humanity in there, because otherwise it just feels like a factory with parking fees.
Awesome, thank you. Kaley, you have anything to add?
I don't think I have anything to add that hasn't already been said.
Awesome, thank you. And thank you for that great question there, Christy. Any other questions? All right, Jim. You're currently muted, Jim, if you're talking.
Sorry, it took me forever. I'm on my phone. Hey, all. I'm Jim Mancini. I'm at the University of Washington, Include Collaborative and Echo. It's nice to see Zack. Great job on this. So very interesting. Really appreciate all of the perspectives. And I guess what I'm kind of my question for you all is, what do we do next? Are there ways to collaborate? Are there, I guess my role at UW is to train providers, train primary care providers around, kind of exactly what you're talking about. And so the work is started, and I guess I just want to know, what can we do? Kaley, I'd love to connect with you specifically, so I'm able to do that through Zack, but, just wondering, what you all think about, sort of next steps, how do we get this information into the medical community better, because I feel like, this is such good information, and, and we know there are people who, as Kaley said, are very invested in doing this the right way, but the education hasn't been there, and the support hasn't been there, and their leadership doesn't support this type of work because it takes more time, right? So I'm wondering, just thoughts about what next steps are from each of you.
It's a good question. Which one of you wants to take that first?
This isn't something that I have a lot of personal experience with, but I do know that patient advocacy groups exist. And I think that is one of the most important ways that we can try to get our voices heard by people that are interested. Because I think that a lot of healthcare systems, individual people and providers want to better understand how they can support their autistic patients, want to ask these questions, but don't necessarily have the structure in place for that kind of communication and collaboration to happen. So, but finding opportunities for patient advocacy groups, for patients to share their experiences with one another, and then, amplify that to the kinds of entities that will listen, is really important. And that's, like I said, that's just not something that I have personally experienced. My route to changing the system is by working in it, is by becoming a doctor and trying to change it from the inside out. But that's not something that everyone can do, or not something that everyone wants to do, which is absolutely fair. So there has to be these better ways of creating lines of communication for patients to be heard by the providers that want to listen.
Awesome, thank you, Kaley. Carrie, I saw you unmute earlier, so I'm assuming you have things to say there.
I unmuted by accident, but I was saying I'd love information. Like, I would take my fancy regents to a disabled doctor, but that's not something that's in the information that's provided by UW or my health insurance. And we have started to become more culturally responsive and put language and gender identity and And I would like that information. Now I know that I'm a weird consumer in that way, because some people be like, oh my gosh, I don't know if I want a doctor that has tremors or something, you know, how about this? But I would like information so I could have to go through fewer people. Also, just thinking about Kaley's comment, so often we listen to the family members, we don't listen directly to the people with disabilities. I have to say that family members' perspectives on disability are often the complete opposite of what I feel as a person with a disability. So, and non-disabled people like talking to other non-disabled people is what I've discovered over the years. And so people are like, I've consulted, I've done my stakeholdering, and they've just talked to somebody else who has a pitiful story.
Awesome, thank you. Yeah, I think what I'll add to this is, it comes down to the people in the positions of power who have the ability to, bring people with disabilities like into the, teaching centers and education institutes for doctors. It takes a lot of advocacy for that to happen. So yeah, feel free to connect with us, Jim, later on, and we can see if there's any opportunities to collaborate there. So I do see, yeah, it's now 3:32. So thank you all so much for being here and listening to us. A big thank you to the panelists for, their willingness to be vulnerable and share these stories and their personal experiences. And I hope this leads to, fruitful change, whatever that looks like. We are recording this currently and we will upload it on YouTube whenever Jay feels like it. So some point next week, most likely. So we will send this webinar to everyone who RSVP'd. So thank you all so much and good luck out there. All right, bye all.